There is a clock inside your brain right now. If a stroke happens, that clock starts ticking down. Every minute, 1.9 million brain cells die. Yet here is what is terrifying. Most strokes do not start with the dramatic collapse that we see in movies. They sneak in quietly. They pretend to be normal. Today I will teach you the subtle signs your body whispers before a stroke and what to do in the first 10 minutes that can save your life, maybe even yours. A stroke is a blood flow haste. Either a clot blocks the blood highway or a vessel bursts like a tire on the road. In both cases, the brain starts screaming for oxygen. Although the brain has no pain receptors, it sends signals in strange ways. Words tangle, one side of the body goes silent, eyes glitch like a flickering screen. This isn't a disease of the elderly alone. More young adults than ever are having strokes right now, in their 20s, 30s, and 40s. Stress, high blood pressure, diabetes, and smoking, these are the silent villains everywhere. This enemy hides, but it leaks clues. These are the 7 quiet alarms most people ignore. Number 1, one eye sees shadows or doubles, vision that wobbles for even seconds. Number 2 is sudden personality flip. If they are calm, they turn to be confused. If they were friendly, they turn to be aggressive. Then people will blame stress, not the brain, shutting down. Then number 3, a weird headache, unlike any other. It feels like lightning behind the eyes. No build up, just a bang. Number 4, one arm doesn't listen. If you try lifting both hands up, one will sag and forget how. Number 5, words sound wrong. Either you speak nonsense or everyone else suddenly sounds muffles. Then number 6, a lopsided smile. The mirror will never lie. One side droops as if it is asleep. Then number 7, random imbalance. You walk as if the ground has tilted. Individually, these symptoms look harmless. Together, they spell danger. Your brain is saying, I can't breathe. Doctors call this the golden hour. But in reality, the first 10 minutes decide the final outcome. Your reaction must be fast, like a fire drill. Step 1, call emergency services immediately. Time is brain and there is no driving by yourself, no waiting. Step 2, note the exact time symptoms started. This determines which life-saving treatments is allowed. Then step 3, do not give aspirin unless a doctor says so. Because if the stroke is from bleeding, aspirin makes it worse. Then step 4, keep them awake and talking. If the speech fades away, the symptoms will worsen fast. This is how heroes are made, not with cups, not with speed. Doctors can clear a clot with a drug called TPA or physically remove it with a procedure called thrombectomy. These are miracles of modern medicine. Yet there is a catch. A TPA works best if given within 3 to 4.5 hours. A thrombectomy will work within 24 hours for a select patients. People don't die from strokes because the hospital was weak. They die because someone waited too long to call. Therefore, if you or anybody happens to have a stroke, the first 10 minutes will decide the outcome, and your reaction must be fast. Remember, time is brain. Call emergency services immediately. Do not drive yourself. Do not wait. Since the drugs like TPA and procedures like thrombectomy only works within a period of hours, therefore you must act fast. Maybe this already saved a life. Maybe you'll remember a drooping smile, a stumbling step, a sudden strange sentence, and you'll choose action. You must know the letters F, A, S, T, acronym FAST. F, face drooping. A, arm weakness. S, speech difficulty. T is time to call. The acronym FAST. It is simple, sharp, and life-saving. Share this with the people you love. Bravery is knowledge in motion. Knowledge in motion. I help you protect your brain long before you need a hospital. Stay curious, stay prepared. See you in the next one.